Did you know that one of the deadliest cancers often goes unnoticed until it's too late? Colon cancer, also known as colorectal cancer, is one of the most common and life-threatening cancers worldwide. Yet shockingly, many people overlook its early warning signs, mistaking them for minor digestive issues. By the time the symptoms become severe, the disease may have already progressed to an advanced stage, making treatment more difficult. But here's the good news. When detected early, colon cancer is highly treatable. Recognizing the silent symptoms can make all the difference in saving your life or the life of someone you love. In this video, we'll uncover 10 critical warning signs of colorectal cancer that you should never ignore. Some may seem harmless, but they could be an urgent call for medical attention. Stay with us until the end, because understanding these symptoms might just be the key to early detection and survival. Be sure to hit the like button, subscribe to our channel for more life-saving health tips, and turn on the notification bell so you never miss an update. One of the most common, yet often overlooked silent symptoms of colon cancer is a sudden and persistent change in your bowel movements. If you've been experiencing ongoing diarrhea, constipation, or an unusual stool consistency that doesn't seem to improve, this could be a red flag. Colon cancer can cause significant disruption within your digestive system, leading to irregular bowel habits. These changes, especially when they persist for weeks or worsen over time, shouldn't be ignored. While it's normal for bowel movements to fluctuate occasionally due to changes in diet, stress levels, or mild gastrointestinal infections, the key here is consistency. When these shifts in bowel patterns become frequent and prolonged, it's crucial to take them seriously. In some cases, colon cancer symptoms like altered stool consistency may be accompanied by other signs, such as blood in the stool, unexplained weight loss, or abdominal discomfort. These combined signs can indicate a more serious underlying issue that requires immediate medical attention. Moreover, it's important to note that the nature of the changes in your bowel movements can vary depending on the location of the cancer in the colon. For example, tumors in the left side of the colon may cause more frequent bouts of diarrhea, while tumors in the right side might lead to constipation or feelings of incomplete bowel evacuation. Understanding the nuances of these silent symptoms of colon cancer can help you better communicate with your healthcare provider and facilitate a more accurate diagnosis. Pencil-thin stools. A subtle yet significant warning sign of colon cancer that often goes unnoticed is the appearance of pencil-thin or ribbon-like stools. This can occur when a tumor partially obstructs the passage of stool through the colon, narrowing the space and causing the stool to take on an abnormal shape. These changes in stool consistency are one of the silent symptoms of colon cancer, and they can be a sign that something more serious is developing in the digestive tract. While conditions like irritable bowel syndrome or even stress can sometimes cause thin stools, it's important to note that a persistent change in the shape or size of your stool, especially if it lasts for an extended period, should not be ignored. Symptoms of colon cancer like this could suggest a physical obstruction in the colon, which is a potential sign of a growing tumor. The bowel's ability to move stool through the colon may be hindered by the presence of a tumor, leading to a change in stool shape, often becoming long, narrow, or ribbon-like. Even if you don't experience other obvious colon cancer signs and symptoms, such as blood in the stool or unexplained weight loss, any lasting alteration in your bowel movements, including the appearance of pencil-thin stools, should be thoroughly evaluated by a healthcare professional. Early detection of colon cancer. Silent symptoms like these can significantly improve treatment outcomes, as identifying cancer in its early stages allows for more effective intervention and potentially less invasive treatment options. If you notice that your stool has become persistently narrow or abnormal, it's crucial to consult your doctor. Don't wait for additional symptoms to develop. Early intervention is key when dealing with colon cancer symptoms. Blood in stool or rectal bleeding. One of the most concerning signs of colorectal cancer is the presence of blood in your stool. However, many people mistakenly dismiss this as a symptom of hemorrhoids. While hemorrhoids can indeed cause rectal bleeding, it's important to recognize that colon cancer can also lead to blood appearing in or on your stool. This is a serious red flag that should not be ignored. The appearance of bright red blood in the stool often indicates bleeding from the lower part of the colon or rectum, whereas darker tar-like stools may point to bleeding higher up in the digestive tract. Both types of blood in stool can be linked to signs of colorectal cancer, and it's essential to understand that any noticeable blood, regardless of the color, is a warning sign that demands immediate medical attention. If you notice blood in your stool, even if it's a small amount, don't wait for other symptoms to appear. Seek medical care as soon as possible, as this could be one of the earliest and most detectable colon cancer signs. Early diagnosis and intervention are critical in managing colon cancer effectively and improving long-term outcomes. A healthcare provider can evaluate the cause of the bleeding, run tests, and, if necessary, determine if it's related to colon cancer or another condition. Even if you have a history of hemorrhoids or other benign gastrointestinal issues, don't take any form of rectal bleeding lightly. Timely attention to signs of colorectal cancer is essential, as early-stage colon cancer is more treatable and manageable. Quick reminder, if you're finding this information helpful, subscribe for more expert tips to help you live a healthy lifestyle. Chronic bloating, cramping, or a constant feeling of fullness in the abdomen could be more than just a minor digestive issue. They might be linked to colon cancer. These persistent symptoms often occur when a tumor grows and begins to obstruct normal digestion, putting pressure on the colon and surrounding organs. Unlike the occasional discomfort that comes from overeating or mild indigestion, this type of pain doesn't subside with dietary changes, antacids, or over-the-counter medications. If you experience ongoing abdominal pain or discomfort that doesn't go away, it's important to take it seriously. While many digestive issues are temporary, persistent pain or bloating may be a sign of something more serious. It's crucial to consult with a healthcare provider to rule out serious conditions like colon cancer. Early intervention is key to diagnosing the issue and addressing it before it progresses further. Do you ever feel like you need to use the bathroom again immediately after finishing? A constant sensation of incomplete bowel movements known as tenesmus can be an uncomfortable and frustrating experience. This sensation may suggest that something is obstructing the colon, such as a tumor, which can make it difficult for the bowel to fully empty. While occasional feelings of incomplete bowel emptying may be linked to temporary digestive disturbances, if this sensation becomes frequent or persistent, it's important to take it seriously. It could indicate that a tumor or other obstruction is affecting the normal function of your digestive system. This ongoing discomfort can significantly disrupt daily life, and ignoring it could allow a potential issue to worsen. If you experience this feeling regularly, it's crucial to consult a doctor to ensure a proper diagnosis and rule out any serious underlying conditions. One of the lesser-known signs of colon cancer is unexplained anemia, which can develop due to slow internal bleeding caused by a tumor in the colon. This ongoing blood loss may not be immediately noticeable, but over time, it can lead to a significant reduction in red blood cell count. As a result, you might experience persistent fatigue, weakness, dizziness, and even pale skin. Many people mistakenly attribute exhaustion to a busy lifestyle or stress, but if you're constantly feeling drained despite adequate rest, it could be a sign of something more serious. Symptoms like shortness of breath, brittle nails, or lightheadedness are additional indicators that should not be ignored. These can be related to anemia and might signal a need to investigate underlying causes, including colon cancer. Early detection and appropriate treatment can be vital for improving your chances of recovery. Additionally, regular screenings and awareness of colon cancer prevention strategies can help detect potential issues before they escalate. Unexplained weight loss, especially if it occurs quickly and without any changes to your diet or exercise routine, is one of the key colon cancer warning signs. Losing weight without trying can be a significant indicator of many types of cancer, including colon cancer. Cancerous tumors consume the body's energy, which can result in unintentional weight loss. Additionally, tumors can interfere with nutrient absorption, making it difficult for your body to maintain a healthy weight. If you experience a rapid drop in weight, typically 5% or more of your body weight within just a few months, without altering your eating habits or physical activity, it's crucial not to ignore this symptom. This sudden weight loss can be a serious risk factor for colon cancer, and it may signal an underlying health issue that needs immediate attention. Fatigue is a common symptom of many illnesses, but colon cancer-related fatigue is different. It's an overwhelming exhaustion that doesn't improve with rest and can significantly affect your daily life. Colon cancer may also cause an imbalance in your body's metabolism, leading to persistent weakness. If you constantly feel worn out and sluggish, it's important to get checked out. An unusual darkening and thickening of the skin, especially in areas like the neck, armpits, and groin, can be a surprising but important sign of colon cancer. This condition, known as malignant acanthosis nigricans, is characterized by the sudden appearance of velvety hyperpigmented patches on the skin that can develop quickly and spread rapidly. While this condition is rare, it is often associated with internal cancers, including colon cancer, and may indicate the presence of an underlying malignancy. The skin changes associated with malignant acanthosis nigricans are not just cosmetic, they could be one of the signs and symptoms of colorectal cancer that shouldn't be overlooked. If you notice any unexplained darkening or thickening of your skin in these areas, it's essential to seek medical evaluation as soon as possible. One of the rarer and more concerning symptoms of advanced cancer is the sudden, widespread growth of fine, unpigmented hair across the body. This condition, known as hypertrichosis lanuginosa acquisita (HLA), is typically linked to underlying malignancies including colon cancer. The appearance of this fine, soft hair, often referred to as fetal hair, can be a sign that the body is responding to a serious internal condition. HLA can develop rapidly and unexpectedly, affecting areas such as the face, arms, back, and chest. While this condition is not exclusive to colon cancer, it's important to recognize that sudden abnormal hair growth may be a sign of advanced cancer. If you notice this unexpected hair growth on your body, it's essential to consult your doctor right away to determine the underlying cause. Early diagnosis and treatment are crucial in managing any potential health issues, including colon cancer. Colon cancer often develops silently, but recognizing these symptoms early can be life-saving. If you've noticed any of the signs mentioned in this video, don't wait. Schedule a consultation with your doctor as soon as possible. Early detection through regular screenings, a healthy diet, and staying informed can help prevent serious complications. Did you know that over 25% of adults worldwide have fatty liver disease, and most don't even know it? It's often called a silent threat because it develops unnoticed for years until serious damage has already occurred. If left untreated, fatty liver disease can lead to inflammation, scarring, and even liver failure. The good news? Your body gives you warning signs long before things get critical. In this video, we'll break down 8 key symptoms that could indicate fatty liver disease and what you can do to stop it in its tracks. Make sure to watch until the end because recognizing these signs early could save your life. And if you find this information helpful, don't forget to leave a like and subscribe to stay informed about your health. What is fatty liver disease? Fatty liver disease, medically known as hepatic steatosis, occurs when an excessive amount of fat builds up inside liver cells. While it's normal to have a small amount of fat in the liver, when this fat becomes excessive, it can lead to inflammation and potentially severe liver damage. Over time, if left untreated, fatty liver disease can cause scarring, cirrhosis, and even liver failure. There are 2 main types of fatty liver disease: non-alcoholic fatty liver disease, NAFLD. This type is primarily linked to poor dietary choices and an unhealthy lifestyle, including being overweight, sedentary, or having an imbalanced diet high in processed foods and sugars. NAFLD is increasingly common and is now one of the leading causes of liver-related health problems globally. Alcoholic fatty liver disease, AFLD. As the name suggests, this form of fatty liver disease is caused by excessive alcohol consumption. Drinking too much alcohol puts stress on the liver, leading to fat buildup, inflammation, and damage over time. Both types can cause serious health risks if not managed. However, the problem is that fatty liver disease often doesn't show noticeable symptoms early on. In fact, many people may have it without even knowing. Still, your body does send subtle signals. If you can recognize them, you may be able to catch the condition early and take action to protect your liver. Common causes of fatty liver disease. Several factors contribute to the development of fatty liver disease, and many of them are linked to modern dietary habits and lifestyle choices. Overconsumption of omega-6 vegetable oils. Oils like soybean, corn, and canola oils are commonly used in processed foods and cooking. While they are often marketed as healthy, when consumed in excess, they can disrupt the balance of fats in the body and contribute to fat buildup in the liver. High intake of sugary foods and refined carbohydrates. Diets high in sugar, particularly refined sugars found in sweets, sodas, and processed foods, can lead to insulin resistance. This condition forces the liver to store more fat, increasing the risk of fatty liver disease. Excessive alcohol consumption. Drinking large amounts of alcohol regularly stresses the liver and leads to inflammation, fat buildup, and eventually liver damage. High fructose corn syrup in processed foods. Fructose, especially in the form of high fructose corn syrup, found in many sugary beverages and processed snacks, can directly contribute to fat accumulation in the liver. Certain medications and viral infections. Some medications, such as steroids and viral infections like hepatitis, can also play a role in the development of fatty liver disease. The tricky part? Many people with fatty liver disease experience no symptoms until the condition has progressed significantly. That's why it's so important to stay aware of your health and recognize the subtle signs that your liver might be in trouble. Fortunately, if you know what to look for, catching it early could make all the difference in preventing long-term damage. 8 signs of fatty liver disease. Fatty liver disease may not always present obvious symptoms, but your body does send out subtle signals that something might be wrong. Here are 8 common signs that could indicate fatty liver disease and help you take action before it progresses further. 1. Right shoulder pain. If you've been dealing with consistent pain or discomfort in your right shoulder, neck, or under your shoulder blade, it may not just be muscle tension. The liver could be to blame. Why? The liver plays a key role in bile production, which is essential for digesting fats. When the liver becomes clogged with excess fat, bile production is disrupted, causing it to become thick and trapped. This leads to inflammation, and the swelling can put pressure on the phrenic nerve running along your right side, resulting in pain in the upper back, neck, or shoulder. If this pain persists, and you can't link it to any other reason, it might be time to check your liver health. 2. Abdominal fat, also known as a potbelly. An expanding waistline, especially around the abdomen, is one of the most common signs of fatty liver disease. Fat starts to accumulate inside the liver, and as it fills up, the excess fat spills over to the surrounding areas, especially around the belly. This kind of abdominal fat, known as visceral fat, isn't just unsightly, it's also dangerous. It wraps around internal organs and increases the risk of serious health issues, including high blood pressure, heart disease, and type 2 diabetes. If you've noticed a significant change in your waistline, it could be an indication that your liver is struggling. 3. Spider veins. If you've started noticing small web-like veins appearing on your skin, it could be a sign of liver dysfunction. When the liver is overwhelmed and unable to process excess hormones like estrogen, it can weaken blood vessels, which may then appear as spider veins. These tiny red or purple veins often have a branching or radiating pattern and are commonly seen on the face, chest, or legs. While spider veins can be harmless in some cases, their presence in combination with other symptoms of liver problems warrants attention. Quick reminder, if you're finding this helpful, be sure to subscribe for more healthy tips like this. For men, an unusual growth of fatty tissue beneath the nipples is another sign that fatty liver disease may be present. An impaired liver struggles to metabolize estrogen properly, leading to hormonal imbalances. Over time, this can cause gynecomastia, the development of enlarged breast tissue in men. If you're noticing unexplained tenderness or swelling in your chest, it might be worth discussing with your doctor as it could be linked to liver health. If you notice that one of your feet or ankles, particularly the right one, is more swollen than the other, it could be a sign that your liver is having trouble functioning properly. Liver damage affects your body's ability to manage fluid balance, leading to a condition called pitting edema. This causes swelling in the lower extremities, particularly the feet and ankles. If you press on the swollen area and a dent remains after releasing the pressure, it's a clear indicator of fluid retention. This symptom should not be ignored, as it may suggest your liver is no longer processing fluids efficiently. An itchy feeling on the palms of your hands or the soles of your feet could seem minor, but when it's persistent, it could point to a liver issue. When your liver becomes overloaded with fat, it struggles to process bile. As a result, bile can build up in your bloodstream and leak into your skin, triggering an allergic reaction that causes itching. This condition, known as pruritus, is common in liver disease and can cause discomfort and frustration if left untreated. Did you know that an underactive thyroid can sometimes be linked to fatty liver disease? The liver plays a vital role in converting the inactive thyroid hormone, T4, into the active form, T3. If your liver isn't functioning well, this conversion process is impaired, leading to symptoms of hypothyroidism such as fatigue, weight gain, and sluggish metabolism. If you're experiencing these symptoms alongside other signs of fatty liver disease, it might be time to address both issues simultaneously. Feeling drained all the time, even after a good night's sleep, can be a major red flag when it comes to fatty liver disease. When the liver is struggling, it becomes less efficient at absorbing important nutrients, including fat-soluble vitamins like A, D, E, and K. This leads to nutrient deficiencies, which in turn contribute to chronic fatigue and a general feeling of sluggishness. If you find yourself constantly exhausted with no clear explanation, it could be a sign that your liver isn't processing nutrients as it should. Many of these symptoms may be subtle or easy to overlook, but recognizing them early could help you take the necessary steps to prevent more serious liver damage. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional for further evaluation and to discuss potential treatment options. How to reverse fatty liver disease. The liver has an incredible ability to heal and regenerate, but it needs the right support to do so. By making some strategic lifestyle and dietary changes, you can help your liver recover and start reversing fatty liver disease. Here are 6 effective steps to get started. One of the biggest contributors to fatty liver disease is the consumption of inflammatory vegetable oils, such as canola, soybean, and corn oils. These oils are high in omega-6 fatty acids, which can promote inflammation and fat buildup in the liver. To support liver health, ditch these oils and switch to healthier options like coconut oil, extra virgin olive oil, and avocado oil. These oils are more stable when heated and provide beneficial fats that support liver function. Your liver plays a key role in breaking down fats, but when it's compromised by fatty liver disease, it can struggle to process fats effectively. One way to help your liver is by using digestive enzymes. A high-quality enzyme supplement that contains bile, pancreatin, and betaine hydrochloride can support the breakdown of fats and ease the burden on the liver. These enzymes can also help detoxify the liver and improve digestion, allowing your body to absorb essential nutrients more efficiently. One of the most effective ways to reverse fatty liver disease is to reduce your intake of sugar and processed foods. These foods, particularly refined carbohydrates like bread, pasta, and sugary snacks, contribute to insulin resistance and fat buildup in the liver. Instead of processed foods, focus on nutrient-dense options like grass-fed meats, eggs, wild-caught fish, and sulfur-rich vegetables like garlic, onions, and broccoli. These foods support liver detoxification and provide essential nutrients that promote liver health. Milk thistle is one of the most potent natural remedies for supporting liver health. The active compound in milk thistle, silymarin, helps to promote liver detoxification and repair. To support your liver's detoxification processes, consider taking 150 milligrams of milk thistle extract daily. This powerful herb boosts the production of glutathione, the body's master antioxidant, which is crucial for neutralizing toxins and repairing liver damage. Over time, this can help regenerate liver cells and reduce fat accumulation. Intermittent fasting is a highly effective strategy for improving liver health and reversing fatty liver disease. By giving your liver time to rest and repair, you allow it to focus on healing and regeneration. One popular fasting method is fasting for 20 hours a day, consuming all your calories within a 4-hour window. This fasting regimen triggers autophagy, a process where your liver breaks down and recycles damaged cells. Autophagy not only helps cleanse the liver but also promotes overall health and longevity. Start your day with a natural liver cleanse by drinking a combination of apple cider vinegar and lemon water. Mix 1 tablespoon of apple cider vinegar with 2 tablespoons of fresh lemon juice in 500 milliliters of water, and drink it in the morning. This drink helps to boost bile production, which aids in fat breakdown and liver detoxification. Apple cider vinegar also helps balance your body's pH levels and improve digestion, giving your liver the support it needs to function more efficiently. If you recognize multiple symptoms from this list, it's crucial to take action now. The earlier you make changes, the better your chances of preventing serious liver damage. Don't ignore these warning signs. Prioritize your liver health today. If you found this video helpful, don't forget to like, share, and subscribe for more life-saving health tips. If you want to learn more about natural remedies for health, watch this next video.